Hi, this is a short video about the American Stem Cell Therapy Association Physician Guidelines. ASCTA has a mandate to produce safe adult stem cell therapy. We have lab guidelines to make that possible. We have practice guidelines or medical practice guidelines for physicians who would use adult stem cell therapy, as well as a stem cell reimplantation treatment registry, where every patient that receives a stem cell reimplantation will be entered into a tracking database. All of that will produce adult stem cell therapy that's safe. This video, however, focuses solely on the practice guidelines component. That's the medical practices guideline. The ASCTA medical practices guidelines first looks at the type of stem cells. And there are many different types of stem cells. There are iPS cells. These are cells that can be taken from the skin, for instance. Genes can be inserted, and they will become stem cells. There are embryonic stem cells. These have been throughout the news for the last decade or so. They're obviously taken from an embryo. There are cord or fetal stem cells. Cord blood is being saved at this point in many different donation and cryostorage banks. Fetal stem cells are commonly used overseas. Someone else's adult stem cells are also currently being considered for use. And then obviously there's your own adult stem cells, or what we call autologous cells. So let's look how the ASCTA guidelines would handle each one of these stem cell types. The ASCTA guidelines would not allow iPS stem cells to be used. Even though they may have great future potential, they're not ready for safe stem cell therapy now. Embryonic stem cells would fall into the same category. While these may have great future potential, they're not ready for safe stem cell therapy now either. Same thing for cord or fetal stem cells and someone else's adult stem cells. Because of the risks, they're not available or ready for safe stem cell therapy now. Your own autologous stem cells, however, are ready for safe stem cell therapy now, so the ASCTA guidelines would allow their use. Let's look briefly at how the ASCTA guidelines would look at changes made to autologous adult stem cells, or AASCs. Some of the changes that are used commonly in the research community include inserting genes, long-term culture, or exposure to exotic growth factors. The ASCTA guidelines would consider physiologic cell culture as well as short-term cell culture. So when it comes to inserting genes, how would the ASCTA guidelines handle that issue? The ASCTA guidelines do not allow the insertion of genes into adult autologous stem cells. They do not allow long-term culture because of the risks involved, nor do they allow exposure to exotic growth factors. What the ASCTA guidelines do allow, because these things are ready to produce safe stem cell therapy now, are short-term culture of stem cells, as well as physiologic culture, or the exposure of stem cells to the types of conditions, chemicals, growth factors, etc., that would be commonly found in the body. Thanks for watching this short video on the ASCTA medical guidelines.